अरे एक और जो एंटी एजिंग आपको ऐसा लगा आपके लाइक इन दीज इयर्स दैट अब जो लोग आने लग गए हैं प्रोसीजर्स के उनकी एज ब्रैकेट एवरेज शायद पहले अगर 45-50 साल होती होगी अब शायद 30 से 35 साल के लोग आने लग
Now,
गए
अभी लोग जल्दी आ रहे हैं because they don't want to age.
हाँ
So that is why we have a lot of anti-aging treatments which are available.
Same.
So regenerative medicine is taken a huge popularity.
Yeah.
Anti-aging is basically क्या है कि आपको हम right from starting from basic skin care to using PRP, using Botox, using fillers in the right way, then transferring your own fat cells into an appropriate area which can rejuvenate. See, when you're young, your fat is up here. As you go old, your fat also goes down. So,
वो sagging होती है.
वो sagging जो होती है. The sagging is not only just the fat sags, the skin also sags. When don't forget, your bones also become smaller. So the tissues tend to slide down from all those areas. So that is something which will be evident at about 55, 60 years or 70 years. So the new treatment modalities are the regenerative medicine. और आजकल एक्सोसोम का कंसेप्ट आ गया, फ्री रेडिकल. So there are a lot of treatment. So basically these are treatments aimed at preventing the aging process.
Effective.
These are effective treatment, but it has to be used judiciously. It is not across the board, right? Like fat transfer. I'll give you an example of fat transfer. So when we do a procedure called as, a facelift procedure, suppose everything is sagging, when we tighten it up, we also inject some fat at points where it is deficit or it is gone down. So you can inject fat taken from your stomach or somewhere else, and then we can redistribute the fat on your face.
Yes.
So that gives you again that kind of a look, We do a surgery called as a blepharoplasty, where your eyes, the first sign of aging is actually the eyes. Your eye bags appear, your skin becomes wrinkly. So you can do what is called as a blepharoplasty. You can reset the fat, you can tighten the skin, and you can inject some fat. Instead of fillers, you can inject the fat. And fat का सबसे बड़ा advantage क्या है कि fat once it is set there, it is there for life.
अच्छा.
Yeah, fat is not something like a filler. Filler you have to repeat after every 9 months to 12 months.
And fat from your own body.
Obviously.
So essentially it's just
It's your own fat,
yes.
redistributing, yes.
Yes.
So any person, and for the face you don't require too much of fat.
Yeah.
Like for the eyes and all that, we'll require about 3-5 cc's for each eye. So 10 cc's of fat चाहिए. But it definitely does rejuvenate. People get lip fillers done. So we say get fat filling done.
Yeah.
That's more permanent, more natural results.
And no chemicals,
No chemicals, no filler material. But yes, चक्कर क्या हर बार यही बात आती है कि आप यहाँ से फैट निकालेंगे फिर वहाँ प्रोसेस करके डालेंगे. So patients are comfortable. Most people will come like an afternoon procedure. You come, get the Botox done, get the filler done, and go. But yes, now we are seeing the downside of fillers also, because it does cause a lot of fibrosis or scarring inside the tissues. So patients who've had a lot of fillers in the face, when we do a facelift, we see the changes which are evident, because when we open up, then we see the changes. So those are, fillered faces, which there's a lot of scar, the normal planes are lost. The normal tissue architecture is lost. Because I think a filler is a chemical.
Right.
It may mimic some of the body's own material, but then again it is artificially created and injected.